Hey there, my name is Lauren. I'm going to be your nurse today. How are you?
Good, how are you, Lauren?
Good. I'm going to be doing a full head to toe assessment on you today. We're going to be looking at your eyes and listening to your heart and your lungs and looking in your ears and your nose. Does that sound good with you?
Sounds great.
All right. First, we're going to start off with your scalp. Scalp. Head is symmetric, no lumps or bumps or lesions. Hair is thick and evenly distributed. You have any pain when I touch your head?
No.
All right. I'm going to palpate the temporal artery. All right. And temporomandibular joint. Can you open your mouth for me? Can you move your jaw from side to side? All right. It's nice and smooth movement. I'll just use with that. Okay. All right. Can you push your hand to my face? There you go, like that. There we go. And then skin. All right. Very good. Okay. All right. All right. Next, I'm gonna look at your face. Your eyebrows are even and symmetric. Your frontal sinuses. We'll palpate them.
Okay.
Maxillary sinuses.
Okay.
Any pain when I touch those?
No.
I'm gonna percuss. Okay. Your eyelids. Close your eyes for me. Your eyelids approximate complete when closed. Eyelashes are evenly distributed. No redness or drainage or swelling from the eyes. Puncta are normal in size. No swelling. Can you open your eyes for me?
Mm-hmm.
All right. And look up for me. All right. The conjunctiva is clear. The sclera is white. No drainage coming from the eyes. All right. Okay. All right. I am going to, let's see, right here. I'm going to palpate your lymph nodes, okay?
Okay.
We got pre-auricular, posterior auricular, occipital, jugulo-digastric, submental, submaxillary. Okay. All right. We got our cervical chain, posterior cervical chain. And we got our, let's see, supraclavicular. All right. We got a deep cervical chain, posterior cervical chain, and superficial cervical chain. All right. All right. Next, I'm going to do a couple eye exams, okay?
Okay.
First, I'm going to look at the side of your eye, look at your cornea and your lens. No scratches or abrasions. Good. Okay. All right. And I'm going to look at your fundus and your optic disc. Okay. And just keep looking forward at me. Does that feel okay?
Mm-hmm.
Okay. The fundus is a light red, and the optic disc is a creamy yellow. Do your pupillary light reflex. Get your pupils.
Okay.
Finger.
Okay.
Okay. Pupils accommodate. All right. And I'm going to shine this at the bridge of your nose to check your corneal light reflex.
Okay.
And they are even. Okay. I'm going to do another couple exams on your eyes. If you could cover your right eye for me.
Okay.
We're going to check your peripheral vision, okay?
Okay.
And when you see my finger come across, we should see it at the same time. And when you see my finger come across, I want you to say yes.
Okay. Yes. Yes. Yes.
Okay. I'm going to do the other side.
Okay.
This side.
Yes.
Very good. And I want you, we're going to do tracking of your eye. I want you to follow my finger.
Okay.
Tracking is parallel in both eyes. And we're going to do an accommodation test. I want you to look at my finger, and then you're going to look at the wall behind me, and then look at my finger, and then we'll look at the wall behind me, okay?
Okay.
Okay?
Okay.
Very good. Alrighty. A couple of tests we're going to do with your face. We're going to check your sinuses already, but I'm going to get you to grit your, clench down on your teeth and smile and puff your cheeks. Okay, and the other one. Puff cheeks. Let me do the cotton balls. Oh, raise your eyebrows. Raise your eyebrows. There we go. And I'm going to get you to close your eyes, and when you feel me press this on your face, if you do, I want you to say yes, okay? I want you to close your eyes. Very good. Alrighty. Eyes, ears. Okay, I'm going to look at your ears. Let me palpate them first. Palpate your ears. Tragus pinnae. No signs of bumps or abrasions. Any pain or tenderness when I touch your ears?
No.
Oh, okay. I'm going to inspect the canal. The canal looks free of foreign bodies. No redness or swelling or drainage. I am also going to be looking at her tympanic membrane. Tympanic membrane is a pearly gray and is translucent and is intact and is slightly concave. Okay. All right. Good. And we're going to do a couple of hearing tests.
Okay.
The first test we're going to do is I'm going to close this ear and I'm going to whisper something over here, and I want you to repeat it if you can.
Okay.
1, 2, 3.
1, 2, 3.
Okay.
5, 6, 7.
Okay, very good. The next test we're going to do is the Weber-Renée test. I don't have a tuning fork, but it tests air conduction over bony conduction. I'll strike the tuning fork and I'll place it above the top of her head. Make sure it's equal on both sides that you can hear it. Next, I will strike the tuning fork and place it behind her bony prominence on a mastoid process. And when you stopped hearing it, you would let me know. And I would place it beside her ear. And when you stopped hearing it, you would let me know. And I'd strike it again, do it on the other side, bony prominence. When you stopped hearing it, you'd let me know. And on the side, when you would stop hearing it, you would let me know. And the expected result is that the air conduction should be twice as long as the bony conduction. Okay, that's that test. All right. Next, I'm going to check out your nose. Your nose is symmetric. It is midline. And I'm going to inspect your nose. Clean this off. Alrighty. Good. Terminates. They're normal in size, no deviated septum, no drainage, redness, or swelling. Um, and I'm going to check the patency of each nostril. We're going to do 2 smell tests. I'll close this nostril. Tell me what you smell. If you smell it.
Fingernail polish?
Yes. We're going to do the other one. Close this nostril.
Alcohol?
Yes. Very good. Alright, I'll put those up. Okay. Alright, next I'm going to check your, I'm going to get you to shrug your shoulders.
Okay.
And I want you to do your head from touch your shoulder. There we go. Then turn left to right like that. And I'm going to get you to chin to your chest. Okay. And then up. Alright, very good. I'm going to inspect your neck. Trachea is midline, no swelling, bumps, or lesions. I'm going to palpate and listen to your carotid artery.
Okay.
Alright, and next I'm going to listen to your lungs, and we will be, I'll be palpating, listening to them, and percussing, okay?
Okay.
Alright. First we're going to inspect the chest. No, skin is smooth and intact, no lumps, bumps, or lesions. Her chest is symmetric, even respiration is breathing, no labored breathing. The AP diameter is less than the lateral diameter. AP diameter is less than that. And I'm going to check for symmetric expansion. I'll check that on the back. And take a deep breath for me. Okay. And my thumbs move out and it's symmetric, smooth and intact. No lesions or bumps, anything like that. Okay. Any pain or tenderness when I touch you?
No.
Okay. Next test we're going to do is for tactile fremitus. And when I touch you, I want you to say the word 99.
Okay.
Okay?
99. 99. 99. 99.
Okay. And I'm going to percuss. Okay. Now I'm going to listen to your breath sounds.
Okay.
Check. And for the purpose of the exam, we're not going to get her to take a deep breath every single one, but I'm letting you know where we would listen. All right. And again, when I place my hands on you, I want you to say the words 99.
Okay. 99. 99. 99, 99, 99.
Okay. Now I'm going to percuss. And now we're going to listen. Can you take a deep breath for me? Next, I'm going to check your costovertebral angle. You're gonna feel a light thump on the back of your kidney. If you feel any tenderness or pain, let me know. Okay.
Mm-hmm.
Any pain right there? Yep. Okay. All right. Okay. Next, we're going to listen to your abdomen. So I'm going to get you to lay down on the bed.
Okay.
Cover. Keep it covered. Thank you. Next, I'm going to listen to your heart sounds. First, I'm going to check the anterior part of your chest. It is symmetric, it's smooth, no lumps, bumps, or abrasions. I'm going to listen to the apical pulse while I palpate her carotid pulse. And I'm going to listen to the heart sounds. Aortic, pulmonic, Herb's point, tricuspid, and mitral. Next, I'm gonna be checking your muscle mass and symmetry and palpating some of your pulses of your extremities. Okay. Brachial pulse, radial pulse. Okay. And next, I'm going to look at your abdomen. I'm going to palpate it, and I'm going to listen to it, listen to your bowel sounds, and I'm going to do some percussion on it. Okay. Okay. I'll look for the midline here. Go. It's flat, no marks or lumps or bumps or abrasions. Okay. All right. I'm going to listen to the bowel sounds in all four quadrants. You doing all right?
Mm-hmm.
Okay. Okay. I'm going to light palpation. You're not tickles, right? Light palpation and a deep palpation. Any tenderness or pain there? Okay. And palpate your bladder. It's not full. You're fine. All right, next we're gonna check your lower extremities and your pulses. On your feet here. A lot of blanket here. All right. I palpate the femoral artery. It's symmetric and even. Popliteal pulse. I cannot feel that though. Right. Posterior tibial. Dorsalis pedis. All right. And I'll get you to, we're going to be doing a few leg exercises, okay? First thing I'm going to do is I'm going to check your reflex in your foot, the Babinski reflex. Okay. Okay. Can you press down on my hands? All right. Can you move your ankles around? There you go. Excellent. All right. Now we're going to do just some leg exercises, okay? Okay. And I'm going to get you to bend your knee for me. Okay, I'm going to get you to go straight up if you can. There we go. We're going to go in. Or let's see, bring your, kind of with your hip. There you go. And then out. There you go. All right, well, I'll stretch this back out. Do the same with the other. Go up, then go up. Or you can do that.
Oh, I'm sorry.
No, either way. And then go out. And then go in. Very good. And stretch that back out for me. Excellent. And now we are going to sit up. Take this off of here. All right. We'll do a couple tests right here. And do some digital finger touches. Okay. And twist your wrist like that. Okay. And we're going to go stretch them out and up. Very good. And we're going to do hand slaps. Very good. All right. And I want you to touch my finger and then touch your nose, okay?
Okay.
Very good. Okay. All right, I'm going to get you to come around on this side.
Okay.
And we're going to do a couple little tests. You can actually go ahead and stand up if you want to. No, okay. All right, let me make sure we get you in the line here. Well, that's got it pretty good. Seems like it's getting it very good, doesn't it? Sorry. Well. There we go. Okay, we're going to do a couple tests with your motor function and your gait. I want to get you to first put your hands above your head, okay, and then put them like this, okay. And then behind you, okay, and we're going to do some tests with your spine. You go left for me, and right, and go forward and backward. There we go. And I want you to extend your leg like that and down. There we go. Goes it with the other one. Any pain in your spine or back when you do it? Okay. We're going to do a couple tests. I want you to touch your heel to your shin and go down. Okay. And do it with the other one. All right. And we're going to do a couple walking tests. First, I'm going to get you to put your hands by your side. And for 20 seconds, we're going to do the Romberg test. And I get you to close your eyes and as far as your balance goes, okay? Okay. Close your eyes for me. And this would go for 20 seconds. Okay. You can open your eyes up. Okay. Excellent. And I'm going to get you to do a couple walking tests. I'm going to get you to just walk up 3 steps and then walk back. All right. Now I want to get you to walk like 3 steps on your heels. Okay. And then walk back on your toes if you can. Okay. Excellent. And I'll get you to walk toe to heel.
Okay.
Very good.
Okay.
All right. And that's it. Oh, I need to do your patella reflex. Let me get you to sit back down here. I'm going to check your knee reflex.
All right. Okay. Sorry.
All right. I would check her patella reflex. I don't have a reflex hammer, but I would check it right here. The normal reflex is a jerk out. Check right there. Good. All right. And check your mouth too. Let's do that. Need to inspect your mouth. I forgot that one.
Okay.
I'm going to use this. All right. Lips are intact, smooth, and midline. Can you open your mouth for me? All right. Teeth are intact, no loose or missing teeth. Can you stick out your tongue and say ah? Uvula is midline. Tonsils are 1+. Gums are healthy and pink and intact. No lumps, lesions, white patches, none of that. Can you touch your cheek for each side? Okay. And put your tongue on the roof of your mouth. And then out. Down. Very good. How do you feel?
I feel great. The best assessment I've ever had in my life.
Alright.
You did good.
Let's try something else. Oh, I have a little bit. I think that's it. Alright.
I think the other stuff